Hi, my name is Anthony Munene. I work with Give Us Wings as a program officer in charge of health. I would like to take you through a tour of when you come to get services here at St. John's Kayoro Health Center. You're most welcome. So as a client, when you're just coming in, this is where you come in. This is our outpatient department building. So you just walk over here. You come and you have a seat on this bench, just like these clients of us here are doing. Then from here you come and see the clinical officer, who will be the one to do all the prescriptions, do the medical checkups, and prescribe medicine that is to be given to you. After that, we shall also have to do a number of laboratory checks. So we shall just have to come here. And over here we have our very humble laboratory. It's quite squeezed, small, but it gets the job done. So here we have Mr. Amos. Amos is the lab assistant, and he's the one in charge of doing all the laboratory tests. So after he does the tests, he relays the same information to James, who's the clinical officer, who then is also able to make a very good informed decision about what medical intervention or plan is to be given to you. So over here we have our treatment area. So during the day, assuming that you're maybe getting some injections, 1 or 2, and maybe you need to rest, so this is where we do the day admissions. So we have 2 beds, and currently we are utilizing it as an area for today, where we are having some scanning services. Over here we have our sonographer. She's called Ruth, and this is actually where the scanning services take place. As you see over there, we have the ultrasound scanning machine that was generously given to us by St. John's Episcopal Church, with much thanks. Then over here we have also our maternity ward. So this is where all the children that are born, all the children that are born from here. So we have the delivery bed here, and also from here we also have this machine over here which warms. It's a warmer. It's an infant warmer. So when a woman has given birth, we put the child here. We warm the child as we are busy working with the mother who has just given birth. So this is our labor ward, and on a monthly basis we get about 30 deliveries, which is actually quite higher than other hospitals that we have recently been informed. Over here we have the maternity ward, and here is where we have the women who are in labor come and rest as they are we are preparing them to come to give birth. We also use this area to provide family planning services as well, but also we also do antenatal services, just like today. So over here, if you come, we have this lady. She's our midwife. She's called Nambozo Esther, and she's the one who is in charge of all that process of delivery, the antenatal care, the immunization, procedures and everything. She's the one who's in charge of that. Hi, Esther.
Hi, you're most welcome. Here is the antenatal clinic. We provide here maternity services, both immunization, postnatal, and ANC services. Thank you so much.
Thank you, Esther. So as we move over here, just right this way. So this is where we have our kitchen. Again, this kitchen was last year donated, to us by the good people of St. John's Episcopal Church through the funding, and now we have a modern kitchen. So we have meals that are prepared here, both staff, and also sometimes we also assist, the patients to also have some meals prepared for those that are admitted at night. As we come to this side, as you see, we have some babies crying. Today is our immunization day, So most of the women that have come with their infants for immunization are receiving immunization services. Over there, we have this gentleman called Jeremy. He's our vaccinator. So Jeremy comes here every Thursday to provide immunization services, as we see over here. Hello, Jeremy. Yes. All right. So, hi. Thank you.
How are you?
Fine, fine. Yeah. So, like I said, as St. John's, we have various, number of services, both outpatient and also inpatient. So, inpatient ward services, where we admit clients at night. So we have this whole building. It's our inpatient ward, and it's a 20-bed capacity. Again, it was generously donated to us by St. John's Episcopal Church with the support of Give Us Wings International. And we have the male ward and also female ward. So I could just quickly take you through a walk. So over here we have the female ward, and in the female ward, so this is where the women, together with their babies, sometimes come and get support. Over here we have Kayoro Esther. She's our nursing assistant, and over here this is our nursing station. So the person that is directly in charge of all this operation of inpatient services is none other than Ednas Tumsime. Ednas, say hi.
Hello, you're most welcome to female ward. Feel at home. We have 2 patients now. We have a baby, they are all admitted and they are having severe malaria. So they are on their first dose. So you're most welcome to female ward.
Thank you, Ednas. Thank you. So we go over here. So we go to the male ward. So we also have a male ward, and all the male patients that are admitted get to come here, and this is where they're admitted and they receive their treatment services. So Ednas, once again, good come, just welcome. Come in. Ednas.
You're welcome to male ward. This is our male ward. As you see, we don't have any patients on male ward, but we just discharged one of the patients this morning, and there's one who is still in the lab waiting to be admitted. So you're most welcome, but as you know, men, they have poor seeking behaviors. They rarely come to the hospital, but we have them. When they come here, we always treat them. It is not compared like with the female ward. Female ward, the patients come every time. Women, they have good seeking behaviors. Whenever they feel sick, they just come very fast to the hospital. Once more again, you're welcome to male ward. Feel at home.
Thank you.
Thank you.
Thank you. All right. St. John's is a 24-hour, healthcare provider. As we move this way, so you realize that some of our medical staff are provided with accommodation so that they're able to provide 24-hour services, both at night and also during the weekends. So we have that unit over there. So it houses 3 medical staff. We have a nurse who is the assistant nursing officer in charge of nursing. We also have the clinical officer, James, who's in charge of the medical prescriptions, and also he's also the one in charge of all the medical staff. We also have one quarter there which is occupied by Nambozo Esther, who is our midwife. So our patients are actually covered all through for whatever time that they're able to come to get services. I want to thank you all for coming along with me through this tour, and ask that we continue working together to build this health center to the next level. Thank you so much.